Welcome to video lecture number 2 for chapter 15 on the integumentary system. In this video, we are going to cover disorders of the skin and burns. Now, just a little warning, some of the pictures are a little graphic in this video. Also, just a reminder that all terms and abbreviations that you need to know for this chapter are going to be black. The first disorder of the skin we are going to talk about is decubitus or pressure ulcers. Remember that an ulcer is a sore caused by a break in the skin, or as we have known it, a break in the mucous membrane of an organ. Now, this type of ulcer is caused by lying in one position for long periods of time. The pressure from lying down between the bed and the body causes the blood supply to be cut off, forming these ulcers. Unfortunately, once an ulcer forms on the skin, bacteria can enter into the ulcer, causing an infection. The next skin disorder we are going to talk about is dermatitis. The suffix itis means inflammation, and the root dermat means skin. So dermatitis is inflammation of the skin. This is due to exposure to an irritating agent like the sun, certain foods or ointments, or even just dry skin. Now, a form of dermatitis called atopic dermatitis develops when the body becomes sensitive to an allergen or a substance that causes an allergic reaction, such as latex, nickel in jewelry, or poison ivy. Now, the term atopy is a state of hypersensitivity to an allergen, or you might have heard its synonym, allergic. So when you are having an allergic reaction, you are having an atopic reaction. Usually these inflamed spots of the skin become pruritic, which means itchy. Pruritus means itching. Eczema is a general term used for inflamed, itchy skin conditions. When the skin is scratched, it becomes excoriated. An excoriation is a scratch mark, and excoriate means to scratch. To put all these crazy words together, when you are feeling pruritic, that means that you are feeling itchy. When you are feeling pruritic, you excoriate or scratch, which leaves behind excoriation or scratch marks. So I'll say that again. When you are feeling pruritic or itchy, you excoriate or scratch, which leaves behind excoriation or scratch marks. The next disorder of the skin is Nevis, which is a congenital lesion of the skin. Now, a lesion is damage to a tissue. Examples of nevi, which is the plural form of Nevis, are birthmarks or moles. A mole is a benign or non-cancerous localized area of melanin-producing cells. That's why they appear so dark. Now, sometimes moles can become cancerous. So if you see a mole starting to change shape or size or color, or if you have moles popping up on your body that weren't there before, go to a dermatologist and get them checked out. If they think it is needed, they will run what they call a biopsy, which is the removal of tissue from a living person for examination. Through a biopsy, the dermatologist can tell whether the mole is or has become cancerous or not. The last disorder of the skin we are going to cover in this video is MRSA, which stands for methicillin-resistant Staphylococcus aureus. This is an infection caused by a type of staph bacteria that has become resistant to many of the antibiotics used to treat ordinary staph infections. Most MRSA infections occur in people who have been in hospitals or other healthcare settings, like nursing homes or dialysis centers. This type of MRSA gotten from hospitals and healthcare centers are typically associated with invasive procedures or devices that are used in surgeries or intravenous tubing, or also artificial joints. We're now going to move on into burns. Burns in general are the leading cause of accidental death. The immediate threats to life are from fluid loss, infection, and the systemic effects of burned dead tissue. Now, burns are classified according to the depth of tissue involved. First-degree burns, or superficial burns, involve only the epidermis and usually produce inflammation with redness, pain, and slight edema. Remember that edema means an accumulation of fluid. Healing usually occurs within 3 to 5 days, and there is no scarring associated with those first-degree burns. Second-degree or partial thickness burns involve the epidermis and the dermis, but leave some of the dermis intact. These second-degree burns usually produce redness, blisters, and more severe pain, and healing takes place in 2 to 3 weeks with minimal scarring. Third-degree or full-thickness burns involve the epidermis, the dermis, and the subcutaneous tissues, which are often completely destroyed. Healing takes a really long time and involves using skin grafts, which we'll talk about in a second. Fourth-degree burns destroy all layers of the skin and involve tendons, muscles, and also sometimes involve bones. Burn injury to the lungs through damage from heat or smoke inhalation is responsible for about 60% or more of fatalities from burns. So you're more likely to burn from inhaling smoke or the heat than you are from actually being burned. In partial thickness burns, like first-degree and second-degree burns, regeneration of the skin can occur from the remaining cells in the stratum basale. In full-thickness burns, like third and fourth-degree burns, there is no dermal tissue left for regeneration, and skin grafts are needed. The ideal graft is an autograft taken from another location on the patient. It is not rejected by the immune system, which is why it's the preferred method. If the patient's burns are too extensive, allografts from another person are needed. These are provided by skin banks or are taken from deceased individuals or cadavers. A homograft is another name for an allograft, so those are synonyms. A xenograft or a heterograft, those are also synonyms, is a graft from another species, for example, pigs or fish. So just to review, an autograft is a graft taken from the same individual receiving the graft. An allograft or a homograft is a graft taken from another person or a graft taken from the same species. And a xenograft or a heterograft are a graft from another species. And that is going to do it for video lecture number 2.